Why do I bruise after lymphoma blood tests? Have you noticed bruising after getting blood tests, especially if you have lymphoma? This can be a common concern, and understanding why it happens can help ease your worries. Bruising after blood tests, particularly in the context of non-Hodgkin lymphoma, often relates to how lymphoma affects your blood and bone marrow, as well as the nature of the blood test itself. Lymphoma can impact the bone marrow, which is crucial for producing blood cells, including platelets. Platelets are tiny cell fragments that play a vital role in blood clotting. They help stop bleeding by clumping together and forming plugs at sites of injury. When lymphoma affects the bone marrow, it can lead to a decrease in platelet production, a condition known as thrombocytopenia. With fewer platelets available, your blood's ability to clot is compromised, making you more prone to bruising even from minor injuries like a needle stick during a blood test. Moreover, the lymphoma itself or its treatments, such as chemotherapy, can further reduce platelet counts or impair how well platelets function. This can lead to a condition called Pancytopenia, where there are low levels of red blood cells, white blood cells, and platelets. This situation increases the risk of bleeding and bruising. When you undergo a blood test, a needle is inserted into a vein, which can cause minor damage to blood vessels. In individuals with normal platelet counts, this typically does not lead to significant bruising. However, for those with lymphoma-related thrombocytopenia or fragile blood vessels, even this small injury can cause noticeable bruising. In summary, bruising after blood tests can often be attributed to low platelet counts caused by lymphoma's impact on the bone marrow or its treatment. Additionally, fragile blood vessels and the minor trauma from the blood draw itself can contribute to this issue. If you find that bruising is frequent, severe, or accompanied by other bleeding symptoms, it is essential to discuss this with your healthcare provider. They may want to check your platelet levels and consider adjustments to your treatment or provide supportive care, such as platelet transfusions, to help reduce the risk of bleeding. Always remember that understanding your body and its responses is crucial, and your healthcare team is there to support you.